Most of us don't know about meningitis. But the question is, what is meningitis? Do you ever hear about it? If you don't know about it, then this video is for you. Meningitis is an inflammation of the protective membranes, covering the brain and spinal cord. A bacterial or viral infection of the fluid surrounding the brain and spinal cord usually causes swelling. Common bacteria or viruses that can cause meningitis can spread through coughing, sneezing, kissing, or sharing eating utensils, a toothbrush, or a cigarette. However, injuries, cancer, certain drugs, and other types of infections also can cause meningitis. These bacteria were responsible for over 50% of the 250,000 deaths from all-cause meningitis in 2019. They also cause other severe diseases like sepsis and pneumonia. It's estimated up to one person in every 2 or 3 who survives bacterial meningitis is left with one or more permanent problems. Most cases of meningitis in the United States are caused by a viral infection, but bacterial, parasitic, and fungal infections are other causes. Some cases of meningitis improve without treatment in a few weeks. Others can be life-threatening and require emergency antibiotic treatment. Seek immediate medical care if you suspect that someone has meningitis. Early treatment of bacterial meningitis can prevent serious complications. Early meningitis symptoms may mimic the flu. Symptoms may develop over several hours or over a few days. Possible signs and symptoms in anyone older than the age of 2 include sudden high fever, stiff neck, severe headache that seems different from normal, headache with nausea or vomiting, confusion or difficulty concentrating, seizures, sleepiness or difficulty waking, sensitivity to light, no appetite or thirst, skin rash. There may also be some more serious symptoms like fever, severe, unrelenting headache, confusion, vomiting, stiff neck. Bacterial meningitis is serious and can be fatal within days without prompt antibiotic treatment. Delayed treatment increases the risk of permanent brain damage or death. Fatal complications due to the primary infection meningitis are most common within 14 days of admission. The diversity of complications causing death in meningitis suggests that determining the clinical cause of death is essential to the evaluation of novel treatment strategies. The nature of a person's meningitis infection will make a difference in their diagnosis and treatment. That is why it has been divided into 3 parts. Let's talk about it. Number 1. Viral meningitis. Viral meningitis is seldom life-threatening and affects many thousands of people each year. The most common cause of viral meningitis is enterovirus, especially of the echovirus group. These spread most easily by hand-to-mouth transmission, mostly in young children. Number 2. Fungal meningitis. Fungal meningitis is very rare in the United States. It comes from a fungal disease that enters the body through some other location and then spreads to the brain or spinal cord. People with weakened immune systems and babies born prematurely are most vulnerable to fungal meningitis. Number 3. Bacterial meningitis. Although bacterial meningitis infections aren't common, and most people with this condition recover from it, they are very serious when they do occur. Bacteria that invade the bloodstream, especially as part of a condition like sepsis, are the most common route of infection. Bacterial meningitis is also contagious. You can also take some simple steps to prevent meningitis, such as when you get an infection, your immune system kicks in and works to fight it off. A healthy immune system can help prevent an infection from the viruses and bacteria that cause meningitis. Keep your immune system at its fighting best by eating healthy, including fresh fruits and vegetables, whole grains, and lean proteins, and by getting regular exercise. Taking good care of your overall health becomes even more important. Also, be sure to get the sleep you need. It's also important to talk to your doctor if a family member or someone you love or work with has meningitis. You may need to take medications to prevent getting the infection. The precise treatment for meningitis will depend on whether the infection is viral, bacterial, or fungal. If the cause of your meningitis is unknown, your doctor may start antiviral and antibiotic treatment while the cause is determined. Non-infectious meningitis due to an allergic reaction or autoimmune disease may be treated with corticosteroids. In some cases, no treatment may be required because the condition can resolve on its own. Cancer-related meningitis requires therapy for specific cancer. Have you noticed any symptoms of this disease in you or anyone around you? If you have seen these symptoms in someone, then you can share this video with them. And if you have any questions about it, let us know in the comment section below. So guys, stay healthy and stay with Health Conscious.